In the early morning, we met in the cafeteria and we introduced ourselves for each other students. And then we divided into different wards. I was in the neurosurgical ward, and we go up there and introduce ourselves again to other clinical staff. And one of my nurse was, I think she's from China, and she introduced myself to other patients, and then I just started to help how to make the bed making and prepare for the breakfast for the patients, and start with that kind of natural things people do as well in the house. So it's not like a really special word. It's like a just natural, yeah. But they just need some help for themselves. So it was quite typical. I was in the morning shift, so I finished my clinical placement around 3 o'clock, and at the end I should. Actually, they usually do handover around 1 to 2 p.m. and they explain about the patient conditions and everything related to clinical state, and I helped them, which I did for the whole day. So because we was just first year student, first clinical placement, so we actually just observe a lot of things rather than really doing, but still it was really good.
We just met each other because, yeah, and then I met a facilitator, and then she started introduce about what the day would be like, what the week would be like, what she's aiming for, and what she's gonna focus on, what she wanted us to focus on instead, and the competency and what we should do, what we shouldn't do, because we are just outfish. That was our first clinical only, so. Yeah, and then we went to our ward, as what she said, separately. And then I was introduced to the RN there, and then I still remember when I was arrived there, because after those kind of stuff, it was already 9 o'clock. So the patients started getting dressing and shower and breakfast or whatever.
On my first clinical, I had a morning shift. So each day I usually begin with bed making, because my nurse used to tell me, "Oh, can you change bed making?" So I do the bed making first, and then often she asks me to do the ops. But usually that ward always running busy, so they just to say to us that just using the electronic machine, so because it tells you everything, like 5 vital signs. If you're first year, you know what's that later on, and then and I just give hands to RN, maybe change nappies or just a pressure sore, just roll the patient to one side, and just ask RN that, do you need my help? Can I give you a hand? And the nurse will tell you which one she would prefer for me to do that. On clinical, I talk to basically my nursing staff, of course my facilitator, my colleagues, and even patients. Also patients' families. They are good source to talk. Just talk about basically, for example, if you have any questions, for example, because you're gonna get a handover paper on each ward, and you will of course have some abbreviations that you will have not clue about what does that mean. So you just ask the nurses what they are, and then you'll be able to tell the patients that what's that meaning, because sometimes patients ask oh, what's this test, what does that mean? So then even though you're first year, if you understand by asking the RN what does that mean, then you will be able to tell them about something in your own words. So it's good.
On my first clinical, every 4 hours I do the ops, including taking blood pressure and body temperature, and respiratory rate, pulse, and everything you can do as a first-year student. And besides that, I did some neurological obs, including I asked the patient to hold my hands and squeeze firmly, and ask them to tell me what date is it and what season is it, where they are, what their name is, like to test their brain is functioning well. And making bed, of course, and taking shower, of course. Yeah, it is important to talk to the patient. They tell you some things which they couldn't tell the nurse, RN. So in my clinical world, it was limited. So there was a time in which the visitors can come and go out. It was set, so almost the time the patient was alone, they didn't have many sources to talk to, so they were pleasure to have someone to talk to. So I stayed a lot of time with patients and talked to them.